Now let's see the gluteus medius and the gluteus minimus muscle. The gluteus medius and minimus, they are the intermediate and the deep layer muscle respectively. So for the gluteus medius to see, we have to remove the gluteal aponeurosis, and for that let's see the posterior gluteal line, which is situated somewhere here, the anterior gluteal line, which is situated here, and this one is the inferior gluteal line. So this gluteus medius muscle, it is going to arise from the area below the iliac crest between the posterior gluteal line and the anterior gluteal line, and this muscle, it is going to get origin from the gluteal aponeurosis overlying this muscle, and this muscle, it passes downward and laterally and going to form one tendon and going to insert at the lateral aspect of the greater trochanter. So with the tendon, this muscle is going to insert over the lateral surface of the greater trochanter of the femur. So this is the gluteus medius muscle. The posterior part of this gluteus medius muscle, it is going to overlap by the gluteus maximus muscle, while the anterior part of this gluteus medius muscle, it is going to be covered by the gluteal aponeurosis, and the site for the intramuscular injection, when we divide the gluteal region into 4 parts by one vertical and one horizontal line, the upper and the outer area of the gluteal region, this is the site, this is the preferable site for the intramuscular injection. So the upper and the outer area of the gluteal region is the safe site for the intramuscular injection, because the intramuscular injection in this area will not lead to any injury to the nerve. So the gluteus medius muscle is the muscle which is getting the intramuscular injections underneath the gluteal aponeurosis. Now the second muscle, that is the gluteus minimus muscle. Let's draw the posterior gluteal line, the anterior gluteal line, and the inferior gluteal line. This gluteus minimus muscle, it is completely under cover of the gluteus medius muscle situated between the anterior gluteal line and inferior gluteal line, and this muscle, it is getting origin from this area and passes downward and laterally and going to form one tendon, and that tendon, it is going to pass anterior to the greater trochanter and going to insert over the anterior aspect of the greater trochanter. So the insertion of the gluteus medius, it is on the lateral aspect of the greater trochanter, and the insertion of the gluteus medius, it is on the anterior aspect of the greater trochanter. When this gluteus medius as well as the gluteus minimus and the tensor fasciae lata, 3 muscles, this trio get contract, it will lead to the abduction of the hip joint. These muscles are also responsible for the medial rotation of the hip joint. These 3 muscles, these are the gluteus medius, gluteus minimus and tensor fasciae lata. All 3 are supplied by the superior gluteal nerve. And these 3 muscles are responsible for the medial rotation and abduction of the hip joint. So as in case of the normal walking, when one foot is off the ground and the other foot is on the ground, the contraction of the gluteus medius and minimus along with the tensor fasciae lata is responsible for keeping the pelvis in the form of the abduction, and that's why the lifting of the foot will not lead to the sagging of the pelvis, and the horizontal line of the pelvis, it is going to be maintained. While in the case of the paralysis of the gluteus medius minimus and the tensor fasciae lata, it will not lead to the abduction of the pelvis, and that will lead to the sagging of the pelvis to the opposite side, at the time of the lifting of the foot. And after some time, the patient thinks that when he or she bend the spine to the affected side, it will lead to the maintenance of the horizontal position of the pelvis, and that's why the patient having a lurching gait, patients having a sagging of the pelvis to the opposite side at the time of the affection of the gluteal muscles, gluteus medius and minimus, along with the tensor fasciolata especially. And this sign, it is called as the Trendelenburg sign.